Hello everyone. Today, we're delving into the world of a medication known as duloxetine, commonly recognized by its brand name, Cymbalta. As with all our discussions, this is intended for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Duloxetine, often referred to by its brand name Cymbalta, is an oral medication classified as a serotonin-norepinephrine reuptake inhibitor, SNRI. Its primary function is to balance certain natural substances in the brain, specifically serotonin and norepinephrine. Initially approved by the FDA in 2004, it's primarily prescribed for the treatment of major depressive disorder, MDD, generalized anxiety disorder, GAD, and certain types of chronic pain conditions such as fibromyalgia and neuropathic pain. Additionally, duloxetine has shown efficacy in managing symptoms of diabetic peripheral neuropathy. It's important to note that this medication may take several weeks to reach its full therapeutic effect, and it's essential to follow your healthcare provider's instructions diligently. Warnings: Duloxetine comes with its set of precautions. It's not recommended for use in children and adolescents under the age of 18 due to limited data on safety and efficacy in this population. Additionally, it's crucial to inform your healthcare provider if you have a history of bipolar disorder, seizures, liver disease, kidney disease, glaucoma, or bleeding disorders, as duloxetine may exacerbate these conditions or require dosage adjustments. If you are pregnant, planning a pregnancy, or breastfeeding, it's essential to discuss the potential risks and benefits with your healthcare provider before initiating treatment. Before taking this medicine. Before starting duloxetine, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its components. Individuals with a history of substance abuse or dependence should use duloxetine cautiously, as it may increase the risk of dependence or misuse. If you're taking other medications, especially monoamine oxidase inhibitors, MAOIs, selective serotonin reuptake inhibitors, SSRIs, or certain medications for pain, migraines, or psychiatric disorders, it's crucial to inform your healthcare provider to avoid potential drug interactions. You should not take duloxetine if you have used an MAO inhibitor in the past 14 days, as a dangerous drug interaction could occur. Before starting the medication, inform your doctor if you have ever had liver or kidney disease, seizures or epilepsy, bipolar disorder, manic depression, a history of drug abuse or suicidal thoughts, or if you are scheduled for surgery or certain X-ray procedures with injection of dye. Side effects: As with any medication, duloxetine can cause side effects. Some common side effects may include nausea, dry mouth, constipation, dizziness, drowsiness, fatigue, decreased appetite, increased sweating, and sexual dysfunction. It's essential to be aware of these potential side effects and discuss any concerns with your healthcare provider. Additionally, duloxetine may increase the risk of suicidal thoughts or behaviors, especially in young adults under the age of 24. If you experience worsening depression, mood changes, anxiety, panic attacks, insomnia, irritability, agitation, aggressiveness, severe restlessness, or thoughts of self-harm or suicide, seek medical attention immediately. Furthermore, duloxetine may cause serious side effects including serotonin syndrome, a potentially life-threatening condition characterized by agitation, hallucinations, fast heart rate, fever, sweating, shivering, muscle stiffness, twitching, loss of coordination, nausea, vomiting, or diarrhea. If you experience any symptoms of serotonin syndrome, seek immediate medical attention. Other potential serious side effects include liver problems, bleeding problems, high blood pressure, glaucoma, and allergic reactions. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Duloxetine may interact with other medications, supplements, or herbal products. It's crucial to inform your doctor about all substances you're currently taking to avoid any adverse interactions. In particular, duloxetine should not be taken within 5 days before or 14 days after you have used an MAO inhibitor. Dosage: Correct dosage is essential for the effectiveness of duloxetine. Always adhere to your doctor's recommendations when taking this medication. The recommended starting dose for adults with major depressive disorder or generalized anxiety disorder is 20 mg to 30 mg taken once daily, with or without food. Depending on your response to the medication and based on your doctor's advice, the dose may be gradually increased. For the management of chronic pain conditions, the recommended starting dose is typically 30 mg once daily, with a maximum dose of 60 mg per day. It's crucial to follow your doctor's instructions carefully and never adjust your dosage without consulting your healthcare provider. Avoid. While taking duloxetine, it's advisable to avoid alcohol, as it may increase the risk of liver problems and exacerbate certain side effects. Additionally, be cautious when engaging in activities that require mental alertness, such as driving or operating machinery, as duloxetine may cause dizziness or drowsiness. FAQ. Many individuals inquire about the time it takes for duloxetine to start working. It's important to note that the therapeutic effects of duloxetine may not be noticeable immediately, and it may take several weeks for the full benefits to be experienced. It's essential to continue taking the medication as prescribed, even if you do not notice immediate improvement, and to discuss any concerns with your healthcare provider. Closing. That concludes our overview of duloxetine. Remember, this information is intended for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.